President Trump, if you see this, please save us. I don't even see our American flag anymore. Biden's talking with some kind of crazy flag. This is America. This is our land. Please, President Trump. Please, please, I hope you have a plan. God, please save us. Save us from the devil, please. Y'all, I'm about to have a panic attack. This is our country. Our country. This is awful. God, please save us, please.
I'm kind of freaking out right now. And I'm starting to regret the way I voted, the way I've been thinking. And honestly, I'm scared for my life.
I paid this for healthcare in December 2025. I paid this for healthcare in January 26. I changed nothing, and I'm paying $230 more per month. How is this making America great again?
My name is Angel. I live in Columbia, Missouri. I woke up watching news and finding out we are going to give Argentina a $20 billion bailout while we can't even have health care in this country. And we're falling apart. And our beautiful fucking orange wannabe God seems to think he needs a Nobel Peace Prize, which I don't understand because he's tearing our country apart. I'm really not crazy. I really never knew this. I am 60 years old. And for the first time in my life, I am scared to death to live in this country. I want to take my family and leave. I can't afford passports, imagine. But anyway, please, if you agree with me, call your senators, protest, do whatever you can. But I don't understand why we are giving another country $20 billion when so many people are on the verge of losing health care, so many rural hospitals are on the verge of closing. When this ACA or whatever they want to call it, Obamacare ends, everybody's premiums are shooting up. Not just the poor people you think are on Obamacare, but everybody's, because the whole system's going to have to absorb this. The system's going to have to absorb people that can't afford it and have to go to the emergency room for treatment, and that's all they can get. So we're going to let our people just lay here and die because they can't get health care, but we're going to bail out other countries? I don't understand.
Hi guys, it's your girl Bleezy and you're welcome to Bleezy Reacts channel. If you are joining us, we appreciate you, and also do well to subscribe for more unfiltered and real gist. So guys, 1st January came and reality hit hard. Across the country, MAGA supporters are crying foul over healthcare costs. Higher premiums, fewer options. The same people who cheered policy rose back and now shocked by the bills. Doctors' visits they cannot afford, prescriptions they are skipping, and emergency rooms become the only options. So guys, join us as we get into more videos.
Wendy, the MAGA lady, puts out, I voted for President Numbnuts to piss off liberals. It was really funny. I'm now worried that I may lose my Medicaid now. I have type 2 diabetes and diabetic retinopathy. If I lose my health care, I won't be able to afford my meds and I will lose my vision. I'm in tears. Please help. You're in the find out stage of your fuck around. Thoughts and prayers.
My medication, it runs $20,000 a month without insurance. I make $800 a month. Oh, that will kill me. That would kill my friends. That would kill millions of people in this country if they lose their health care.
We're in California's District 22, a rural community in the state's Central Valley. This district voted for Trump for the first time in 2024, but now his policies threaten one of the benefits people here rely on the most. Do you know anyone personally who voted for President Trump but depends on benefits like Medicaid?
Oh yeah, I know a lot of people.
One resident who would be impacted by Medicaid cuts is 64-year-old Irma Arredondo, who voted for Trump in 2024. Irma has several chronic health issues, including type 1 diabetes. She's also a full-time caregiver for her daughter, who has cerebral palsy, and her sister, who has Turner syndrome.
The medicine that my daughter takes for seizures, I won't be able to afford it. So we feel hopeless if those cuts come, you know. What we're going to do.
Irma was a farm worker for more than a decade. She believes that some of her and her children's health issues can be linked to the pesticides she was exposed to while working in the fields.
Look at me right now. Look at me, how many sicknesses that I have. We got all in the fields. Where else? I feel like these tubby nuts in the back, you know. But why? Why when we put food on their tables? Trump promised a lot of things. I thought it would be more family values and those programs that they really need here.
One of those promises was to protect Medicaid, which 67% of people in this district rely on. It's the largest percentage of any district in the entire country.
Can you guarantee that Medicare, Medicaid will not be touched?
Yeah, I mean, I have said it so many times, we're not going to touch it.
The yeas are 218, the nays are 214. The motion is adopted.
This bill represents the largest cut to Medicaid in American history. It will devastate vulnerable populations.
The largest tax break go to the wealthiest individuals. Are those your values?
No, that's not right.
Irma isn't the only one in District 22 who feels betrayed by the administration's plan to gut Medicaid.
The only people that are hurting are the poor people. People that really need the stuff. Elon Musk doesn't need it. Trump doesn't need it. And, you know, billionaires don't need it.
They're making out big time with this, but they're hurting people in the process.
If we could go back to November, who would you vote for now, seeing what you see?
For either one.
You just wouldn't have voted?
Not either.
I'm having to ask my children to help me do things that should only be my responsibility, and that has broken my heart. It hit 3 days before Christmas, 620% increase in my premium, and it left me with $74 in my bank account. Like, I knew what the payment was going to be, but the first time it was taken out of the bank account, it became the reality, and it crushed me. I'm a Cuban American, and that pretty much means Republican. You're just sort of born a Republican. I think my politics have really changed drastically from, you know, how I grew up to now. I've lived a lot and I've seen a lot. I've had some experience.
I'm on the Affordable Care Act, and next year my premium is going to be $34,000 and my out-of-pocket will be $15,000. This is Maine. My health care has the potential for being $49,000, and I retired early to take care of my terminally ill mother. My husband makes $50,000, brings home $50,000 a year. Our health care could possibly be $49,000 out of a $67,000 income, which is 77% of our annual income. Well, my insurance next year. So that means I won't be getting it, because who can afford that? I will probably not get insurance next year because I literally can't afford it. And this right here is cancer on my face. My last appointment's in December, and my doctor's guessing that I will need more treatment, but I won't get it. I might be one of the 51,000 people that dies next year of cancer. And, you know, I know there's all kinds of reasons why he voted to open the government, but he needs to do everything in his power to get the ACA subsidies reinstated. And frankly, you know, I feel like we've lost our leverage. We've lost our leverage. Mm-hmm. And that means I might lose my life.
Big beautiful bill Medicaid cuts. I'm for it because I'm an able-bodied American citizen right now. I'm headed to work. I work at least 40 hours a week. People need to stop just getting free benefits. If you can go to work, you need to go to work because we're tired of paying for everybody. So Medicaid cuts, we're here for it.
It's my mother-in-law. She worked 40 hours a week too at the same company for 32 years, and she was union, and then she got brain tumors and she lost her health insurance. Because if you're not working, you're gonna lose your health insurance. And then Medicaid and Medicare kick in. Every single person is one tragedy away from having to be on Medicaid and Medicare. You're one brain tumor, one car accident. And for you specifically, looking at you, I can tell you're one heart attack away from needing Medicaid and Medicare. Now, I know that you think everybody that's on them is lazy illegals, but guess what? One day you're gonna need it and you're not gonna have it. And it's not you that's paying everything. It's people like me, the younger generation, that are paying for that for you, for her. Now
Meet Kat from the state of Florida. She participates in the Affordable Care Act marketplace and deals with multiple chronic health issues, such as ADHD and kidney issues.
After her kidney issues began in 2022, Kat's health made full-time work nearly impossible.
I did end up having to get on the marketplace in 2023 because the kidney issues and also with my ADHD. I take the highest level of Vyvanse, 70 milligrams. I need to take it so I can get out of bed, basically. I need these medications to function.
If you can't afford health insurance next year, what happens to your medication?
Well, particularly the Vyvanse is very expensive. Without health insurance, it's $300 to $400.
And from the footage that we just watched together, it sounds like it's a very tough situation for her. And according to some research, about 5 million people in the state of Florida rely on the Affordable Care Act. But let's take a look together and see what her thoughts are about the Affordable Care Act subsidies expiring at the end of 2025.
One of the reasons why I like President Trump is because he uproots everything and changes the dynamics. But when it comes to healthcare, it seems to be a very complicated system. A good portion of Hispanics, we all voted for Trump, so it's kind of like a betrayal, you know?
FAFO Cat, did you not see what he tried to do to the Affordable Care Act in his first administration? Did you not remember that John McCain was the saving vote for the Affordable Care Act? And since you're a Latino and from the state of Florida, I bet during the 2024 election you were, I will vote for Donald Trump. Now that vote is messing with your healthcare. I'm not gonna make fun of your health conditions or anything like that, but you did put yourself into this position by doing a contribution vote, thus enabling the folks on your political side of the aisle that are in office to not care about the ACA subsidies. Because Speaker of the House Mike Johnson has clearly stated that he does not want to put anything related to healthcare up to a vote when it comes to the ACA. Your premiums as well as your medicines are about to skyrocket. But in conclusion, all I have to say to you is best of luck to you and thoughts in healthcare. And have the day that you voted for, because this is like level 100 of the FAFO scale.
A raft of changes come into effect today across welfare, Medicare and energy sectors. Medicines on the pharmaceutical benefits scheme will now be capped at $25 per prescription. This applies to diabetes medication, asthma puffers and the contraceptive pill. However, the price of passports and household energy bills will rise, with the government quietly announcing the end of quarterly energy rebates.
Today, my job released our open enrollment. It started today. I am currently paying $240 every 2 weeks for health insurance for a family, correct? Now, that does not include my vision, dental, 401k, or disability. So when you add all of those in, I'm paying about $550 every 2 weeks for my entire family to have medical, dental, vision. I have disability coverage, and I also contribute to my 401k. We just got our benefits for next year. What I'm currently paying $240 every 2 weeks for is going up to $709 every 2 weeks. That does not include my 401k, my vision, my dental, my disability insurance. How can I possibly survive paying $1,500 just in medical coverage? Just in medical coverage. They already kicked our spouses off of our coverage because they said if your spouse can get insurance through their job, we're cutting them off. So not only did you cut them out, it tripled. $700 just for medical benefits every 2 weeks. I'm not even talking about a month. This is bi-weekly. How is this? And I work in medical. How is this fair? How does this work for anybody? I can literally cry. I have a daughter that's graduating college next year. I have a daughter that's getting married next year. On top of that, we have to live. How? How can anybody live spending just $1,500 a month just in healthcare that doesn't cover our dental, that doesn't cover our vision? On top of that, there's a $2,000 deductible and a 20% co-insurance. So either way, anytime we go to the doctor, anytime we do anything, we got to come out of pocket. On top of what I'm already paying. When in the fuck is this nation supposed to be great again? Because it's getting worse.
This isn't a political theater. This is a real life. Healthcare doesn't care who you voted for. It just sends the invoice. And now, many are realizing too late that slogan doesn't pay medical bills. This movement is not all about celebrating someone's pain. It's about confronting the truth that politics doesn't disappear after election day. They show up in doctors' offices, pharmacy lines, and overdue bills. Healthcare doesn't care about slogans or party or loyalty. It's about coverage, cost, and who gets left behind. Now that the dust has settled, many are learning that their decision made in November echoes loudly in January. Because when protections are stripped away, reality doesn't whisper, it's in voice. This is what accountability looks like. Not online arguments, not political debate, but real people facing real consequences. And the lesson is simple. When you vote against compassion, eventually compassion won't be there for you. So guys, tell me what you think in the comments. And don't forget to subscribe. See you guys on the next one. Bye.